Okay, now we are doing this lady a second time fulgurate cystoscopy actually. And last year we did a cystoscopy to her, and when we enter inside, yeah, these are some infected particles are floating. There are some red patchy areas in the opposite wall. Here, some areas. This is the newly formed mucosa that we fulgurated last year. It seems quite good actually. Nowadays I improve the procedure a little bit. I sometimes fulgurate behind the Trigon, these areas, if they are patchy, red, inflamed. And now look at this part, a free floating infected particle here. In the Trigon, do we need another fulguration? Not easy to make a decision, but it seems a little reddish and inflamed than normal. Let's look at the rest of the bladder. She had significant infections after the procedure. I will fulgurate these parts too. There are some patients who are not responded to treatment, and I always think they have long-term diseases affecting their bladder, and actually she was not one of them at the beginning. She had a good response. Then she began to have significant infections in not sensitive cultures, in normal cultures. And now I'm trying to make a comment. Here there is a more reddish part. It is maybe the opposite wall coming into contact with this Trigon. And yes, there are some, maybe some thicker tissues. I can make fulguration in these parts. This is urethra. It seems quite normal. And all these patchy areas, this is a more normal part of the bladder. When I look from a distance, you see these patchy areas, and in the opposite wall there's a inflamed area, and here we have some inflammations. Maybe we have some kind of embedded bacteria, some kind of biofilm covered bacteria. Okay, we will start now. Okay, now I am fulgurating this before the Trigon. I will now to make some fulguration spots in bladder in patients who have diseased bladder. I hope this will let new mucosal growth here, and may also work in interstitial cystitis patients. Just when you fulgurate a spot, there will be a tissue healing reaction here. Because we can't fulgurate all the bladder walls. Look at this part, it is really inflamed. And in Trigon, I can barely see, like this part, some more thicker areas. And I will do a superficial fulguration in this part. Because always the Trigon is the most suspicious place for the infections. And here in the urethral opening we have some polyps. I will also try to fulgurate this part. Yeah, other bladder walls seems healthy. I hope this procedure will work for her. Okay, now bladder is closed. I am filling it now. This part is Trigon, and this part is the part which is coming into contact with the bladder Trigon. So I will see now, is it, yes, look at this. There is an inflamed reddish area. Yeah, when we look from a distance, I can say there's inflammation. I am fulgurating this part to let some new tissue formation. So, and this part, I start to fulgurate these areas. Okay, now I am incorporating also the Trigon and try to see the base. For example, here it seems healthy, but in this part, I think there are some embedded tissues here. So two options is making a deeper resection or fulguration. I am checking the thickness of the vaginal wall. It seems enough thick tissue we have here. Maybe let me see this fulguration works. Yeah, I think this will be better. And this is the resection type. It makes maybe deeper penetration and takes out the tissue better. But we have to be very careful on doing this. And this is the upper part. You see, when I fulgurate, I see some leukoplakia tissues in the upper part. Yeah, they are. Okay, now mostly completed. We fulgurated. I don't want to fulgurate all the places. I just want to make some islands of tissue healing. We fulgurated the inflamed parts in the bladder and mostly the bladder Trigon. I will do some more detailed work and finish. Okay, now we completed the Trigon is, yeah, we refulgurated the whole area and the inflamed parts. There's good urine is coming. I can fulgurate all bladder. I did as much as I can. We will see the results. Such areas are needing new tissue formation, so I am just touching